Ms. Frankel.
Thank you. Thank you, Mr. Green, for being here. I want to add my compliment to your organization. I've traveled all over the world. I've met with many of your workers and the NGOs that you fund, and I add the compliment. So
Thank you. My job is usually to get out of their way, quite frankly. They're talented.
So don't take my questions personally today. I want to, first, I think I'll start with a story, and then I want to ask you a question relative to that, because I actually had a visitor to my office a couple months ago, and her name was, doesn't matter what her name is, Celeste. She was 31 years old. She was a mother of 2 children from Mozambique. And I'm not sure if I met her or somebody who knew her, but here's the story. She had lost her husband to AIDS in 2017 and turned to the Mozambique Association for Family Development for help when she discovered she had HIV positive. She was HIV positive. The clinic set a routine for her, and she told me that if it wasn't for these visits, she wouldn't be alive. However, there's a however to this. Apparently, when there was a cut from this clinic's money because of the expanded gag rule, it shut down, and basically she had no place to go. So my first question, because I think people maybe don't understand this, and maybe you could explain it. I know that federal money is not allowed to use for abortions, all right? So we're not going to argue that. I don't agree with that, but I'm not going to argue that today. In the past, other administrations, Republican administrations, have had what's known as this gag rule, which would not permit family planning. It would affect organizations that did family planning. My understanding is under the Trump administration, with what I call its abortion obsession and its desire to placate the very extreme right wing of Americans who are obsessed with abortion, that now the whole gag rule is now applied to all health care money. And so that it's not just in family planning, but also in health care. So if you could just explain that, if that's true, and what is the size of that amount of money that's being affected?
Thank you, Congresswoman. So it does apply to basically all health care funds. But I think the important thing to remember is it doesn't reduce health care funding $1. So the overall funding that is provided for our global health work is not reduced by the PLGHA.
Well, okay, if I could, well, it's not reduced. It is attempting to be reduced here in your budget by a very significant amount, which I would hope you disagree, but I'm not going to put you on the spot. The fact of the matter is, I guess the question is there any data now that you have that indicates whether or not all these NGOs or these clinics that have been defunded have been adequately replaced? Because I just gave you an example of a clinic in a small village that has been defunded, that was doing all the health care for the village. It's been defunded. Have there been replacements?
So let me answer that with a couple of points. So first off, you began by referencing PEPFAR and the important AIDS work that is being done. Some of that, obviously, I will defer to Ambassador Birx for, but I know that she has said publicly that under the budget request, all those who are on ARTs, there's sufficient resources for that to continue. Secondly, on the question you're posing of all of the organizations for which PLGHA is applicable, the vast majority have agreed to the conditions that are at the heart of PLGHA, and those that have not, obviously it is on us then to endeavor to make sure there is a smooth transition to the continued provision of those services. I know that there is an overdue report to you and to this committee. It is overdue by a ways, and it is in the interagency process. we will, as we've done before, make sure we report to you completely and accurately what the numbers are to help address your question.
All right, I would, are we going to have a second round of questions? Okay, thank you, and I'll yield back. I'll ask my other questions later. I do want to note that the administration has paid some attention to women's economic empowerment in regards to, there's a couple of pieces of legislation, the WE Act, there's the new Women's Global Development Prosperity Initiative. But I just want to say that, you know, there's an old expression, don't cut off your nose to spite your face. It is all well and good that the administration would seek to change property laws in countries or find capital for women's businesses. But when you're cutting the budget to educate girls, there's 130 million girls in this world who are out of school. So this budget is asking to cut hundreds of millions from education. And the other thing is women have to be, and girls have to be healthy to be successful. This budget proposes billions of dollars a cut to global health, which gets me back to our initial discussion of the global gag rule, which I think I let you slipperily slide by. And I want to just read something so people understand what it is and how damaging it is, because it is more than just about, it's not really about federal funding of abortion. It's about keeping girls and women from access to full health care and to truthful information from the health care providers. The global gag rule is one of the most deeply damaging policies ever enacted on foreign assistance funding. The gag rule blocks U.S. federal funding for non-governmental organizations that provide abortion counseling or referrals, advocate to decriminalize abortion or expand abortion services, even when those activities are funded independently of USAID. Reinstated by President Trump shortly after he took office in 2017, the newly expanded version of the gag rule targets organizations working on any program funded by U.S. global health assistance, including programs that expand access to contraceptives, reproductive health care, HIV testing, treatment and prevention, efforts to fight malaria, and public health programs working to improve child and maternal health outcomes. And this, I will agree with those who say, represents the most dangerous version of an already damaging legislation ever stated. And just to give an example, so that people are clear, we don't allow federal funding of abortion. That's another issue. But if you go into a clinic, like I mentioned before, in a small village in Mozambique, where people get their general health care, if a woman who is pregnant even asks the question, where can she get abortion? She is not allowed to be told that, or this clinic loses its funding. Even if there happens to be a pamphlet lying on a table that actually doesn't mention abortion, but actually mentions the name of another healthcare clinic or organization that actually gives abortion referrals or does abortions, they lose their funding. So I want everyone to be clear about this obsession that is hurting millions and millions of women all over the world now. So I guess I can, do I have time? I still have time. So I'm going to ask you a question. You don't have to defend this policy. I'm not asking you to do that. I don't think you can. But I do want to ask you about the Women's Entrepreneurship and Economic Empowerment Act, which identified key barriers to women's economic empowerment, including child marriage, female genital mutilation, access to education, gender-based violence. Unfortunately, did not mention health care, but that's for another day. Could you just tell us whether or not, given especially these suggested cuts, that do you have the staffing and training needed to conduct the gender analysis that's required and to really get into the sort of the meat and potatoes of the legislation?
Good question, and thanks for your great support of the gender work that we're all talking about. So the President's National Security Strategy recognizes that gender empowerment, women's empowerment is a national security matter. And we feel as though we have, in the last couple of years, gotten some new exciting tools from the WE Act to WGDP to Women, Peace, and Security. And so we're excited about it. And just in the first year of WGDP, 12 million women have been touched and new opportunities created. So we can always do more, but we believe we have the resources necessary to continue on with this work. And we're excited to partner with you and to show you some of the early results, but to keep it going, because it's I think one of those great bipartisan areas where there's a very bright future.
And Madam Chair, I want to just add one thing. If people, a lot of people don't understand why we care on this committee and in Congress about health care in other parts of the world. And why would we care if somebody in a village has access to health care? Why do we care if a woman has access to contraception? Because you know what? If there's no better example of how we are all interconnected is this coronavirus. And when you look at the spread of disease and the spread of terrorism, what we know, and it's pretty clear, which is why you're in the business you're in, and I thank you again, because I think this is such an important part of our government, is that when countries are more prosperous, when they are healthier, they are safer, and the world is safer. And with that, I hear the knocking of the paddle there, and I yield back.